Hello everyone, welcome back to the channel. In today's class we will be discussing a very important drug in pharmacology, spironolactone. I'll take you through its dose, classification, mechanism, uses, side effects, contraindications, and easy mnemonics. So sit back, take notes if you want, and let's learn step by step. First, let's classify the drug. Spironolactone belongs to the group of diuretics, medicines that increase urine output. Within diuretics, it is specifically a potassium-sparing diuretic, which means, unlike other diuretics, it does not waste potassium. And more precisely, it is an aldosterone antagonist. So the full classification is diuretic to potassium-sparing to aldosterone antagonist. Now let's talk about the dose, which is very important in exams. For hypertension or heart failure, usually 25 to 100 milligrams per day. For severe edema or ascites, can be increased up to 400 milligrams per day. For primary aldosteronism, 100 to 400 milligrams per day. And in PCOS or acne, off-label, usually 50 to 200 milligrams per day. Always start with the lowest effective dose and monitor potassium levels carefully. Now let's carefully understand how this drug works. Normally, in our kidneys, the hormone aldosterone acts on the collecting duct and late distal tubule of the nephron. Aldosterone increases sodium and water reabsorption, meaning the body holds on to salt and water. At the same time, it increases potassium excretion. Now, spironolactone blocks the aldosterone receptor. So what happens? Sodium and water are not reabsorbed, they are lost in urine. Potassium is not excreted, it is retained in the body. That is why we call it a potassium-sparing diuretic. If you want to remember easily, spironolactone blocks aldosterone, so salt and water go out, potassium stays in. Therapeutic uses. Spironolactone has many important clinical uses. You can remember them with the mnemonic HAA-PH. H is heart failure. It reduces mortality and improves survival. A is acne and PCOS. It blocks androgens, so it helps in hormonal acne and excessive hair growth in females. A is ascites. In patients with liver cirrhosis, it is the drug of choice. P is primary aldosteronism. It is used for diagnosis and treatment. H is hypertension, especially in resistant hypertension. So that's HAA-PH. Now, very important, side effects. The main one is hyperkalemia. Because it retains potassium, potassium levels can rise dangerously, leading to arrhythmias. Other side effects are related to hormones, since spironolactone also blocks sex hormone receptors. In males, it can cause gynecomastia, enlargement of breasts. In females, it may cause menstrual irregularities and breast tenderness. It may also cause impotence in males. Remember this with mnemonic HAG-M. Hyperkalemia, amenorrhea and menstrual problems, gynecomastia, male impotence. Now, when should spironolactone not be used? Think of mnemonic HAR. H is hyperkalemia, already high potassium. A is Addison's disease, low aldosterone state, so spironolactone is harmful. R is renal failure. The drug can accumulate and cause dangerous potassium levels. Spironolactone should be used cautiously with ACE inhibitors, ARBs, NSAIDs, and potassium supplements, because all of these can also increase potassium levels, leading to severe hyperkalemia. Let's quickly recap everything. Dose is 25 to 100 milligrams, max 400 milligrams per day. MOA blocks aldosterone to sodium and water out, potassium in. Uses: HAA-PH, heart failure, acne and PCOS, ascites, primary aldosteronism, hypertension. Side effects: HAG-M, hyperkalemia, amenorrhea and menstrual problems, gynecomastia, male impotence, contraindications, HAR, hyperkalemia, Addison's disease, renal failure. If you can remember these mnemonics, you can recall spironolactone in exams easily. That's all for today's video on spironolactone. If you found this explanation clear and helpful, make sure to hit the like button, share with friends, and subscribe for more pharmacology lectures made simple. Thank you for watching, and see you in the next class.